Ladies, I want to guide you through one of the most important transitions in a woman's life: menopause. Menopause is a natural biological process that typically occurs around the age of 50, though it can happen earlier or later depending on genetics, lifestyle, and overall health. During this stage, your body undergoes significant hormonal changes, particularly a decrease in estrogen, which affects not only your reproductive system, but also your bones, skin, heart, muscles, and mood. Many women notice symptoms such as hot flashes, night sweats, mood swings, irregular periods leading to their cessation, fatigue, sleep difficulties, joint or muscle aches, and changes in metabolism. These symptoms are entirely normal, yet they can disrupt daily life. Understanding what is happening in your body and learning how to manage these changes effectively is crucial for maintaining your health, independence, and overall well-being. One of the most significant concerns during menopause is bone health. Estrogen plays a critical role in maintaining bone density. As estrogen levels decline, bone resorption exceeds bone formation, resulting in gradual bone loss and an increased risk of osteoporosis. Osteoporosis is a condition in which bones become fragile and more susceptible to fractures. Unfortunately, osteoporosis often progresses silently, and many women are unaware they have it until a minor fall or movement, such as bending, lifting, or even coughing, results in a fracture. The most commonly affected areas include the hips, spine, and wrists. Vertebral fractures can lead to height loss, a hunched posture, chronic back pain, and reduced mobility. Hip fractures are especially concerning because they can severely limit independence and increase the risk of complications such as infections. Early awareness, preventive measures, and regular monitoring are essential to protect your bones and maintain an active lifestyle. Nutrition plays a central role in maintaining bone and overall health during menopause. Calcium is the most critical nutrient for bone strength, and it should be included in your diet regularly. Excellent sources of calcium include milk, yogurt, cheese, leafy green vegetables such as spinach, kale, and broccoli, almonds, tofu, and fortified products like cereals and plant-based milks. Vitamin D is equally important because it helps your body absorb calcium and maintain healthy bones. Safe sun exposure, even for a few minutes a day, can help maintain adequate vitamin D levels, while supplements may be necessary if recommended by your doctor. Protein is another vital nutrient. It supports muscle strength, helps maintain metabolic health, and protects bones. Include protein-rich foods such as eggs, lentils, chicken, fish, beans, and dairy products in your meals. Other essential nutrients include magnesium, found in nuts, seeds, and leafy greens, which helps maintain bone structure, phosphorus from dairy and legumes, and vitamin K from green vegetables, which aids in bone mineralization. Easy tips include adding spinach to soups, sprinkling nuts over yogurt, drinking a glass of milk with breakfast, and choosing fortified cereals for added calcium. Staying hydrated, improve posture, enhance balance, and protect joints. Flexibility and balance exercises, such as yoga, tai chi, or gentle stretching, reduce the risk of falls and enhance mobility. For women with joint pain or arthritis, low-impact options such as swimming or water aerobics are excellent alternatives. Easy tips for daily activity include taking short walks after meals, using stairs instead of elevators, performing gentle stretches while watching television, or dedicating is also important for joint lubrication, digestion, and overall cellular function. Physical activity is another cornerstone of healthy aging during menopause. Weight-bearing exercises such as walking, dancing, light jogging, or climbing stairs stimulate bone formation and help slow bone loss. Resistance exercises, including bodyweight movements like squats, lunges, push-ups, or using light weights and resistance bands, strengthen muscles. 10 minutes in the morning for yoga or balance exercises. Consistency is more important than intensity. Even moderate activity performed daily can yield significant long-term benefits. Lifestyle choices significantly impact your health during menopause. Avoiding smoking and limiting alcohol consumption are essential because both accelerate bone loss and interfere with hormone balance. Maintaining a healthy weight is critical, as both underweight and overweight individuals face higher risks of bone problems and cardiovascular complications. Stress management is vital because chronic stress can exacerbate symptoms like fatigue, sleep disturbances, and mood swings. Techniques such as mindfulness, meditation, deep breathing exercises, journaling, or even short relaxation breaks during the day can significantly reduce stress and improve overall well-being. Quality sleep is also crucial. Establish a consistent sleep schedule, create a calming bedtime routine, and optimize your sleep environment by reducing noise and light, which helps restore energy, support hormone balance, and improve mood. Easy tips include keeping a water bottle near your bed, avoiding late-night snacking, practicing deep breathing for a few minutes before sleep, and using blackout curtains to improve sleep quality. Medical guidance is indispensable in managing menopause and related health concerns. Regular checkups allow your healthcare provider to monitor bone density, hormone levels, cardiovascular health, and other vital indicators. Bone density scans, DEXA, provide insight into your current bone health and help guide preventive or therapeutic measures. Blood tests can assess vitamin D, calcium, and hormone levels, allowing for personalized treatment plans. Some women benefit from hormone replacement therapy, HRT, to relieve severe symptoms such as hot flashes, night sweats, and mood swings. HRT can be highly effective but must be tailored individually, considering potential risks, including blood clots, stroke, or certain types of cancer. Keeping a health diary to track symptoms, medications, and lifestyle habits can help your doctor provide better guidance. Easy tips include noting the frequency of hot flashes, sleep quality, mood changes, and physical activity to share during appointments. Managing daily symptoms at home can greatly improve comfort. Wear lightweight, breathable clothing during hot flashes, keep a fan or cool cloth nearby, and stay hydrated. Organize daily routines to conserve energy and avoid overexertion. Emotional health is equally important. Maintaining social connections, hobbies, and mentally stimulating activities reduces the risk of isolation, anxiety, and depression. Participate in group activities, volunteer, or pursue hobbies like knitting, reading, or puzzles to stay engaged. Easy tips include scheduling weekly calls with friends or family, dedicating short periods to creative activities, or taking short walks outdoors for mental clarity. Menopause also affects metabolism, often leading to weight gain, especially around the abdomen, and a decrease in lean muscle mass. Resistance training, protein-rich nutrition, and adequate sleep help counter these effects. Cardiovascular health is also affected. Declining estrogen increases the risk of high blood pressure, high cholesterol, and heart disease. A heart-healthy diet rich in fruits, vegetables, whole grains, and healthy fats, combined with regular physical activity, can support both heart and bone health. Easy tips include swapping fried foods for baked or grilled options, including vegetables in every meal, and taking a 10 to 15-minute walk daily. Emotional and mental well-being is often overlooked, but is just as critical as physical health. Hormonal change or dedicating time to hobbies that bring joy and fulfillment. It is also important to understand the interplay between menopause, bone health, and chronic conditions. Women who experience early menopause have a family history of osteoporosis, or have other medical conditions like thyroid disorders, diabetes, or autoimmune diseases may require additional monitoring and more aggressive preventive strategies. Certain medications, such as corticosteroids or anti-seizure drugs, can accelerate bone loss. Preventive strategies for these women may include more frequent bone density assessments, higher calcium and vitamin D intake, targeted exercise programs, and lifestyle adjustments to reduce fall risk. Keeping a detailed record of symptoms, medications, supplements, and lifestyle habits can help your doctor provide more effective guidance. Self-care practices can have a significant impact on overall quality of life. Gentle massages, meditation, aromatherapy, and relaxation baths help reduce stress and improve circulation. Prioritizing time for yourself, even 10-15 minutes a day, can enhance mental and emotional well-being. Regular social interaction, whether through family, friends, or community activities, combats feelings of isolation and promotes a positive mindset. Easy tips include creating a daily self-care routine, Scheduling mini breaks for relaxation and it can contribute to mood swings, irritability, anxiety, or depression. Acknowledging these feelings without judgment, seeking support when needed, and maintaining social connections are essential. Mindfulness, journaling, counseling, or therapy can provide guidance and relief. Engaging in creative activities, volunteer work, or learning new skills can foster purpose, resilience, and a sense of accomplishment. Easy tips include scheduling short periods of quiet reflection, connecting with friends, while menopause is a natural process, how you respond to it determines your quality of life, independence, and overall well-being. By focusing on nutrition, physical activity, lifestyle choices, medical guidance, and emotional well-being, you can maintain bone strength, mobility, energy, and confidence well into your later years. It is important to remember that every small, consistent action you take matters. Integrating simple habits into your daily routine, such as changes. Emotional and mental well-being is equally important. Engaging in social activities, maintaining relationships, pursuing hobbies, and setting aside time for relaxation or reflection supports a positive mindset and reduces stress, anxiety, or feelings of isolation. Simple practices like dedicating 10-15 minutes a day to meditation, reading, journaling, or gentle breathing exercises can improve mood, focus, and resilience. Recognizing your own achievements, celebrating small health milestones, and remaining proactive about self-care helps maintain motivation and a sense of purpose during this transition. Menopause is not an endpoint, but a transformative stage that provides an opportunity to focus on self-care, strength, and longevity. With knowledge, preparation, and consistent effort, you can navigate this stage safely, maintaining vitality, flexibility, and endurance. Every intentional choice, whether it's preparing a nutrient-rich meal, performing a short exercise routine, seeking medical guidance, or connecting with friends and family, contributes to a higher quality of life. By embracing these changes and taking proactive steps, you are investing in your future health and ensuring that your later years are defined by energy, strength, confidence, and emotional well-being rather than limitations or fear. Remember, this is your time to throw vegetables and protein to each meal, taking short walks or gentle exercises, practicing stretching or balance routines, staying hydrated, and tracking your symptoms can create significant long-term benefits. Prioritizing regular checkups, discussing concerns with your healthcare provider, and following personalized medical advice ensures that you are addressing both immediate symptoms and long-term health risks like osteoporosis, heart disease, and metabolic. Time to thrive, and with patience, consistency, and care, you can continue to live life fully, enjoy meaningful relationships, and remain active and independent for years to come.